the mental anguish and health of a woman who suddenly lose their libido.
From where I trained, I think the oldest patient I operated upon was 95 years old. Wow. And she has a partner and she's happy.
Exactly. So, it doesn't mean that we stop having sex and that's life is over. So
there is also another common thing that patients come to me about, which is sexual dysfunction, whereby with all this loss of integrity of the walls and the floor, patient end up not having intimacy, feelings of intimacy.
So when you say reconstruction, that sounds very serious. It sounds a little scary.
It's such a wonderful exercise, and you can do it in the morning, you can do it while you're cooking, when you're driving, when you're watching television, or in a stressful interview like this, which I'm having with
everybody, this is Karen here from Midlife Mojo. Thank you for being with us. Now, this young man here is Dr. Shasi, and he will be teaching us about urogynecological issues that midlife women goes through. So please don't go away, stick around. This is really important. Hi, Dr. Shasi. How are you?
Hi, Karen. How are you?
I'm good. Thank you. And thank you so much for being with us. You're a busy man because it was so hard to lock you in for this interview. So tell us a little bit about yourself.
All right. Hi. I want to thank you, Karen, for giving me this opportunity and this time at least to sit and talk about actually what I do. I also have to thank your husband because he was the one who introduced me to you and got me here today. And I'm very sorry for not giving you the time earlier. That it has been quite a roller coaster in the last couple of weeks coming down to this. So basically, what I do is in Malaysian terminology, I am a urogynecologist. What it signifies, I think the Americans got it a little bit more in a complex way. It is a female pelvic medicine and reconstructive surgery. So it is after we complete our medical school, we're going to complete our masters in obstetrics and gynecology. So urogynecology is a subspecialty of that, whereby we focus on pelvic floor in women and everything that goes in around that.
Okay, so when you say reconstructive, that sounds very serious. It sounds a little scary. So please explain a little bit on that.
So what basically we do is for those who do not have a proper passage, we create a passage. For those who have damaged the passage, we reconstruct the passage. For those who have lost the passage, we bring back the passage to how it is. And for those who have pretty much the passage is occluded, we refashion and revitalize the passage.
And this is really common because for lay people, most of us don't think that. So this is really common.
Well, after age of 40, this is something that really happens to each and every woman. The average age of women who succumb to menopause is around 51 years old, especially those women in Malaysia. Some women, they tend to have this sort of problems that slowly look from the age of 25 to 40 onwards, reaching to old age group.
So let me be clear. So it's like even women as young as 35 can already have some indication of this.
Yes, they can.
Okay. And so what is the most common issues women face, especially in the perimenopause or menopause stage?
So when we talk about the pelvic floor muscle, the pelvic floor muscle is the underlying cause to everything that occurs.
Right.
So as they reach perimenopausal and menopausal state, what occurs is there will be a lack of estrogen.
Yes.
So the lack of estrogen that leads to problems that creep up very, very slowly, because as they get into the perimenopause and menopause state, slowly the estrogen is getting diminished. Diminished.
And in fact, it actually, there's a lot of women actually have a more drastic depletion.
That's right. That's right. So the sort of problems that crops up with these women, number one, they have urinary symptoms, whereby when they're coughing, laughing, or sneezing, they tend to leak, or they are unable to hold their urine really well, and that leads them to excessively leak in the process. This is one part when it's pertaining to the bladder. When it comes to the part of prolapse, that's what we say, the organs, the inner organs of the women starts protruding out. So I will just say to you in a basic layman terminology, let's just say in a room, we have the bladder, that is the ceiling, and the inner aspect, which is where the vagina is and the womb is, and the lower aspect, which where the basement is, whereby we pass our motion, our business. So pretty much with pelvic organ prolapse, either your ceiling is to the basement, or your basement is to the mids of the flooring, or your wall that is supposed to be located at the other corner comes all the way crashing out through the door. And this is what we call as the pelvic organ prolapse. So with this, there is also another common thing that patients come to me about, which is sexual dysfunction, whereby with all this loss of integrity of the walls and the floor, patient end up not having intimacy, feelings of intimacy. They lose arousal, they lose their libido. This is another aspect that I deal with. And then the final part to this is also women, when they reach the menopausal age group, everything due to the lack of estrogen, everything turns dry. And as it turns dry, becomes painful for intimacy. They don't want to have any sort of relationship, and that is a downward spiral from there.
That is another, we bring on to another set. So we will address in a little while about this as well.
And the final part of it is what we call as chronic pelvic pain, and this is whereby the patient is in a constant dull aching pain throughout the process, because like how we have muscles in and around our body, and we can go for massages, but the pelvic floor ends up going in a sustained and tonic state, and this causes them to be in complete pain every single day, 7 days a week.
So if someone who is unclear, and what are the telling symptoms that they should look out for?
All right. So since I spoke about all these 5, let me just break it down to these 5. So when we're talking about incontinence, whereby a woman leaks urine, right? When we talk about the bladder, many of the time this can be due to they would start suffering from leakage of urine, especially when they laugh, cough, sneeze, or lifting anything heavy, or they are in sustained urgency, whereby they have to rush to the toilet. And some, before they reach the toilet, they end up leaking. So we would consider them in a very severe state. So as for pelvic organ prolapse, constantly having the feeling of something falling down, something pressure down below, and some of them will develop back pain, but they're very shy to come and talk about it and tell people that they suffer from such a thing. But they're not too shy to go to an orthopedic surgeon and getting that ruled out. But telling that such a thing occurs is something that women tend to do. As far as the sexual dysfunction, loss of libido, loss of feeling, loss of arousal, these are the things, and the lack of lubrication down below, these are the common things where women suffer from, especially in perimenopausal, going off to menopausal. And as for the chronic pelvic pain, is that what I mentioned, the dull aching pain, burning pain.
So the thing is, what we want to highlight to women is, if you have any of those experiences that doctor just mentioned, please don't hesitate to start asking and getting the help you need. Because if I'm not wrong, is there is it more likely if someone has a hysterectomy, or if they have a normal childbirth, are they more likely to have these symptoms?
Yeah, definitely. So when we are looking at the birth passage, that's what we call it, the vagina, the birth passage. The passage can get damaged due to lack of estrogen, which I spoke about, which is the common hormone that women have. It can get damaged with age, whereby it's lacking the luster that is required. It can be damaged due to childbirth and pushing and straining and whatnot as the babies. And those days, the idea of women in Malaysia love having big babies.
Yes. That doesn't do very well for your vajayjay ladies.
Yes, that's so true. And let's not forget that some at their younger age group, they suffer from very bad constipation, and that leads to ramification for these prolapse problems.
So it can be safely said that having a good diet so that you don't have to push too hard. Having fiber is also
that's right. That's important.
So if you are someone who've gone through hysterectomy, normal childbirth, and constant hemorrhoids, you may, I'm not saying you will, but you may have a higher probability of having this condition. And that's where you really need to up your game in terms of your diet, your fiber, making sure that you drink lots of water and be very mindful, because one thing I learned from the good doctor here is there's a procedure that can help you if you detect this early enough. It's just a small procedure that can change your life. Can you share that with us, please?
Yeah. So many of the times when we are talking about women coming to me with this problem, the first and foremost thing that we start off is lifestyle modification.
Lifestyle,
we have to change the lifestyle that it is. So one, we can start off by slowly, gradually losing weight. Many of our women, they tend to be a little bit overweight, and that can have a profound effect over the birth passage, leading to all the prolapse that there is there. The second thing is for when it comes to leaking urine, avoiding triggers are the most important thing. And today, Karen, I'm going to tell you all the triggers, and I'm sure all those who are watching me today are going to have their eyebrows raised up and wondering, oh my God, these are the things that I should stop. Okay, first and foremost, let's start with the elephant in the room. Coffee, especially caffeine. Caffeine has a profound effect, and it is the trigger to most incontinence in women, whether in younger age group or older age group. That coffee and that caffeine, whether it's a cup a day,
you have to change.
You will realize after you have your cup of coffee, you will be rushing to the toilet within the half an hour.
Yes, it's
and we think it is good, but that is your first trigger. Tea, on the other hand, too, especially those who love green tea, that has a higher effect of caffeine rather than that is there in your light coffees.
Okay.
The third would be fizzy drinks. So for those who love taking cold drinks or drinks that are carbonated, that tend to have a profound effect. It causes an acidic environment leading to urination. The fourth is juices, especially orange, lemon, lime, grapefruit. So those acidic environments are what triggers.
But you're talking very big quantities if you're taking a lot. But if you're just doing the moderate,
Karen, you do know that majority of our population put that slice of lemon in their water, which is marinating throughout the whole day.
We do too.
That's the reason why you have that urgency and you're running to the toilet quite often. That is not flushing anything, it's just irritating your bladder.
Okay, good to know.
And then with us Malaysian, especially in the north, our spicy food, we love our spicy food. So if you don't realize, spicy food has a profound effect on our bladder too.
Oh, wow.
All right. Okay. Those who love raw tomatoes, those again. So well, if you love your curries, I think 1 tomato a day would be fine. But if you're consuming raw tomatoes, you'll be running to the toilet quite often. And then The other thing is artificial sweeteners. For those who don't like consuming sugar, those can cause some amount of irritant to your bladder. And the final thing I would say, that will be a least effect, but if your bladder is damaged enough, it can have a profound effect. That would be dark chocolate.
Oh, you have just taken everything that we like. We don't like the doctor anymore.
But how should I put it to you, Karen? It is not 1 day or 2 days. It's the constant triggers and damage that occurs. So we have this thing called as a layer over the bladder, which is our waterproofing to our bladder.
Yeah.
And all these triggers tend to disrupt that waterproofing. It's in our terminology, medical terminology, we call the gag layer. So when that gets disrupted, this is what causes majority of the women to end up having.
But it really isn't. I mean, who knew? Because we do want to eat natural, so raw tomatoes. I suppose. Right. I think it's also it's fair to say it's about moderation.
That's right. Yeah, absolutely right. But there's no moderation to coffee.
No, there's not, because when you are coffee addict,
yes. Well, the other thing I think you said it correctly by mentioning about avoiding constipation, high fiber diets, and making sure you evacuate well every single day. Those things plays an important role. So I used to, the place I worked in London for a year, I had a wonderful bowel dysfunction nurse called Wendy. And Wendy always said 5 fruits a day, 5 fruits a day. And I used to say, we have big fruits in Malaysia, Wendy. And she said, no, either you take 5 grapes or 5 small grapes, or you take 5 prunes, or you take 5 slices of orange, 5 slices of vegetable. It plays an important role.
Exactly. So consistency in your diet, and making, of course, about moderation as well.
Yes.
And so we do a lot of what we call Kegel exercises. Yes. That's what I try to get women to do. Is that crucial? And what role it plays in this part of our body?
Yeah. So Karen, one more thing I completely forgot. Stay hydrated. Yes. Hydration is important. Excellent. Around 1 to 1.5 liters a day. One thing I would say, do not chug water. Drink it in bits by bits. Yeah. And then probably once you reach around the 8 and 9 o'clock, I think you can cut down on drinking water by that. Yeah. But as you mentioned about Kegel's exercise, so fundamental Kegel's exercise is a very, 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 very important exercise that a woman should do. And it's very easy to do.
Yeah.
There's many articles, YouTubes, apps on Kegel's exercise to perform. But what is very interesting is once you know which is the group of muscles that you need to keep in contracted state and relaxation, then it becomes easy. So right now during this sort of interview, I've already done 5 reps.
Okay. Yeah. And nobody knows.
And you wouldn't have known about it. And these reps are important either which are either you're a man or a woman. Yeah. It is very important for you because in women, it helps the pelvic floor, it keeps it calm and composed. Many of the early stages of urinary incontinence where you're leaking urine or anything that is coming down from your birth passage, especially on the early stages, can get prevented with this. Yeah. It is such a wonderful exercise, and you can do it in the morning, you can do it while you're cooking, when you're driving, when you're watching television, or in a stressful interview like this, which I'm having with Karen right now. It's such a simple thing. And for men, this is also an important exercise for you. It's supposed to improve your stamina and performance, if you know what I mean.
So even men are not exempted from this. So it is really important, both men and women, to learn about the Kegel exercises. So going back to that little procedure, because some women obviously maybe neglected that part of themselves a little bit too far, and we don't want to see 40-year-old women or 50-year-old women wearing that's just not what we want, and that's why we need to know that this procedure, maybe you can explain.
Once you do come in and we do an assessment for you, we'll be able to understand how well and how what is the problem that is there. Conservative management is our mainstay, and what we can do for you is a simple thing like once we spoke about the exercise, there are the other things called vaginal pessaries. It's a small little object looking like a donut that we place it into the birth passage, and it helps keeps the prolapse in check. For those with leakage, especially laughing, coughing, sneezing, there are the ones with the knob which helps prevent that too. Those are something very simple that you can.
Is this procedure?
This is something that occurs as soon as you walk into my clinic, assessed, place the pessary, and
That's it.
and that's it.
So you don't even, it's not like you have to go to any general anesthesia, nothing of that sort. It's less than 20 minutes and safe.
I would say 5. We just have to get, it's like how you go to a shop and you get a nice ring.
Right, okay.
And you need to fit right size and nice fitting. And once you get that done, you're good to go.
So there's hope. But the main thing is you got to listen to your body and understand it so that you get the right help. Now, I guess for some women, because they're very shy, you know, and a lot of them, especially Asian women, when it comes to, you know, it's like the idea that this is your sexual part and all these things. So they will probably go to a normal GP. Can those GP guys do this job? They need to ask for specialists. What is their step? You know, if they go to a GP.
So what is the starting point of this is you can get a referral letter to a GP, and many of the times they would be referred to obstetrics and gynecologist. So they would assess them and see what is their symptoms and what is going about it. So once they have confirmed that this is something within our reach of expertise, they would refer this patient to me. But right now, what I've done, I have educated many of the healthcare, public healthcare and clinical theatres in and around on these other symptoms. And so they are starting to pick up a lot of cases and they've been referring to me. And this has been in a way helpful to me. Yeah, it is.
Okay, so I say life-changing because this is what the good doctor and myself are really concerned is the mental anguish and health of a woman who suddenly lose their libido, not able to reconnect in intimacy. These are the things that affects us. So what is your take? What have you seen when women neglect this?
So this was actually one of the conversations I had with Karen on the phone before I agreed for this interview, is that the awareness of this problem is very, very low among our women. And the reason why the awareness is very low is because they believe that when everything starts falling apart, they go to their older people and elder people at home. And you realize that even the elder people are suffering from this, and they say, it's all right, you just go on with it. This is something that goes, something that you have to go through in your old age, and there's nothing we can do about it. And this leads to so much of a problem. So now what happens is, step by step, the first thing what a woman would feel is she would feel that her body is starting to feel shame over her body, because when you see something prolapsing out or when you're leaking urine, you don't want to be intimate with your partner at that time, that you lose your confidence. And when you feel your loss of confidence, imagine having an intimate relationship and you're leaking, or you're feeling the pain, or you're feeling the anguish. It can be very, very frustrating to women suffering from such a manner. And as this goes on, they tend to feel that, I am unable to do a lot of things that I used to do. So they end up taking this back and keeping it to themselves. And when they do so, they end up having anxiety, having depression, social distancing.
So it really is a domino effect, isn't it?
Yeah, that's right.
It's already a lot of midlife women, because of the lack of estrogen, we already have anxiety, and that's already. And then if you have another issue where it can be resolved, that's the thing. I'm trying to say that it can be resolved if you, first of all, ask for the right help. And that's something that, because of that, again, then your libido, your relationship affected, and then you start to retreat. And this is where our concern, both as a doctor and also as a coach, this is something really important that women, if you are listening, please look for the right help. Message me if you need to, so that we can direct you to the right people to help you and get the right advice. And understand that this can be so easily repaired and changed, right?
Yeah, that's right. It's something that will give hope back. And I could say that from where I trained, I think the oldest patient I operated upon was 95 years old, and she has a partner and she's happy.
Exactly. So, it doesn't mean that we stop having sex and that's life is over. So it's really, really important. So before we end for today, Dr. Shasi, anything that you would like to tell the audience, any word of advice?
So the why we are here today is one thing and one thing alone, and it's all about awareness. And I feel and I believe that every woman should receive some sort of help when required and needed. Currently, social media has helped us in a lot in propagating information out, and I guess in that way, what was our main goal today was to tell you that, number one, you're not alone.
Exactly.
You're not alone in this. There is someone here to help you. Partners who have women suffering from problems like this, you can stay in a helping hand. Try not to fix a problem, because this is something that cannot be fixed by its own. Might need some help, and maybe give her the support and the reason that is required to bring her to some medical professional so they can help arrange something that will improve her quality of life. And what I want to highlight is quality of life is very, very important. I joined this, I think this would be personally on my part, I joined this subspecialty for one reason and one reason only. My own grandmother had suffered from this, and back then we did not know. And I was a young kid, and I used to see her suffer from these issues and problem. And she lived till the age of 85, and with a lot of pain. And today, at this particular time, seeing that smile come back on women and the ability for them to go and live their life the way they are, it's what that I strive for.
Thank you. Is we talk about understanding and advocating for your health. That's our mission here at Midlife Mojo. And so please take this advice, listen to your body, get the right help. And for men who are here to support your wife or your friends, be there for them. Don't judge, because you don't know what is going on. And, take the right action to get them to get the help they need, whether it's a medical help or emotional help. So until next week, thank you for listening in. Please subscribe and like my YouTube channel, and tell us what you'd like to hear more, because I'll bring you more content, and follow us as soon as possible. Thank you.